The Drive with Terry Moore on CFAX 1070.
When an 81-year-old woman came into the Royal Jubilee Hospital Emergency Department in February with dizziness, it did not take long for the pharmacist on the team to figure out it was caused by the pain medication that she was taking. In fact, 1 in 8 patients come to emergency because of a medication complication. Now, this is the start of Pharmacy Week here in the province of British Columbia, and that's just one of the examples about what happens and how things are changing in the world of pharmacy in this country and around the world. Dr. Sean Spina is a pharmacist with the Island Health, and we've got a lot of questions for him about this whole question of what we can do when it comes to the things that we need to know about the drugs that we take and how they're actually able now to find out a lot more about it very, very quickly. Doctor, how are you today, Dr. Spina?
I'm doing well, Terry. Thank you.
Expand a little bit on what you've found when it comes to the use of smartphones and being able to diagnose people and find out more about their pharmacological history.
Well, what we found is a few years ago, in healthcare, we have the best of a lot of things, but when it comes to communication, we do not a very good job with communicating people in a timely fashion. So we incorporated smartphones into our pharmacy world because pharmacists are in a short supply and high demand. But when we looked at the literature at the time, because everybody says everybody needs to have a smartphone, there was actually nothing out there to show that they did any good. So we did a trial to look at their effect on patient care. And what we found, which was actually one of the first trials in North America, we found that by allowing our pharmacists the access to a smartphone, we improve the timely response that they can provide answers to drug questions, medication questions, and they're able to provide better care because of it.
So if I came into emergency and I was having some problems and they wanted to know what drugs I've been taking, what I need, and what the medication is that my doctor has prescribed for me, they would simply they'd get on the smartphone and they would access what area of my information. Where would they go?
Well, that's actually a futuristic piece that you're referring to, and in Island Health we have a new health system coming out called iHealth, which will allow us more digital records. As of today, we can't access the patient records on the smartphone, but it's definitely coming.
Is it a privacy issue or is it strictly technology?
Well, the privacy is there, and that's number one priority. So anything that we implement, we ensure that we have all the privacy pieces in place. And so the technology is there right now, but I think when we move forward within the next year or so, it'll further support it. But
when you take a look at side effects on certain drugs and meds that people may be taking, they can access the smartphone and they can come up with some of the effects on the smartphone because it will give them the information because it's almost like a textbook.
Correct. So when we find out which medications the patients are on, that's one of the key pieces. We have to do a good list from what the patient's on at home, so we can determine what's causing the condition that they're on here they're having here at the hospital, and then we can actually have lots of information on our phones at the bedside, so we can work with the patients to identify what's going on.
I'm really surprised though that 1 in 8 patients come into an emergency ward in a hospital because of a medication complication. How far back does that go, or has that been the normal stat on this whole question?
Yeah, that's interesting. 1 in 8 is about 12% of patients have that.
That's pretty high.
It is pretty high. I've actually read some trials that are upwards in the 30 to 40% as well.
God heavens.
And so when you think about it, most of our patients out there are on medications. When you think about older folks, a lot of medications. And so when patients come to the hospital, all medications have side effects. And quite often, we can do a better job of educating patients with issues with the medications and how to take it and what to watch out for. And so here in Island Health, we have our pharmacists up on the care wards on many of our hospitals, seeing patients. And so when patients go home from our facility, we really try our best to make sure they have a clear understanding of what medications they're on, which ones they're supposed to take. And we also communicate, if we can, with the family physicians who's caring for them in the community, as well as their family community pharmacists, because they're the ones caring for them while they're out in the community, and we like to try to ensure that we communicate effectively between the two.
When a patient comes in that kind of a situation, in many cases, do they have a fairly good knowledge of the kind of medications that they've been taking, or are they just kind of, I really don't know, it's in a bottle?
You know, Terry, it's variable. I got to say, with the computers, and there's a lot of our patients are using technology over the last 5 to 7 years. I'm seeing more and more patients better informed about what they're taking and asking better questions and more informed questions and keeping us on our toes, which is wonderful to see. Personally, I love that patients are taking control of their own health.
Have you also seen when patients do come in that it's important that they also have to have an understanding of interaction of various other drugs that they may be taking or other things that they think are okay, including some of the stuff you can buy over the counter that may very well have an interaction with what the doctor has prescribed?
So I think the patients need to understand that medications in general can interact with each other. And so I'm a strong advocate that if any patient is buying a new medication, even if an over-the-counter medication, they should check with their community pharmacist. Hey, I'm taking these medications and I want to buy this one. What do you think? I think that's a good way to use it. The pharmacists are trained for the interactions.
Sure.
I don't expect patients to know all the interactions. That's not what their role in their care.
But it's good that they are looking and at least having some basic understanding as to what's going on with the chemistry in their body.
Correct.
All right. Now, overall, when you take a look at this, and this being Pharmacy Week, and the utilization of the smartphones to look up the drug information, is this going to save not only time, lives, and also monies in the medical care system?
We know that the smartphones themselves are saving time with answering drug information questions, and if the pharmacists are doing their jobs more efficiently, then that translates in that they can see more patients as well. And this is a really early trial, etc., but I'm really proud of our group here. We just won a national award for this work, so it's very, very, very exciting. But we know that pharmacists up on the wards, seeing patients and rounds, and just their ability to be up on the wards and not in the dispensing medications and working with the patients at their bedside, we know it decreases those drug-related admissions to the emergency room you're talking about. Decreases readmission rates at 3 months. And allows patients to live longer as well. So we're really excited about a lot of the literature out there.
Whose idea was it to put the smartphones in?
It was a group of our idea. It was bothering us that the group is in short supply, and we thought, you know what, we need to improve the ability for the care team to contact the pharmacist in a timely fashion. And I really got to say, VHA or Island Health stepped up to the plate and said, let's see what happens with this pilot, and it was great results.
Just as long as you don't have to pay too much for texting or somebody saying, what are you doing tonight?
We have everything for patients is encrypted, so there's no security issues that we're worried about.
All right. Dr. Spina, thank you very much for your time today. Thank you for joining us on CFAX 1070.
Thank you very much, Terry.
All right, thank you. Dr. Sean Spina, the pharmacist from the Island Health.